to our discussion about food intolerances and leaky gut. For those of you who didn't see the first video, my name is Dr. Pam Grover. I practice functional medicine and anti-aging medicine in Rochester, New York. We're going to talk about the tests for leaky gut. We're going to start with the blood testing. And this specifically is testing for food intolerances. Most experts who believe in food intolerances and leaky gut feel that if you have multiple food intolerances proved on a test, then you automatically have leaky gut. If you don't understand that, then if you watch our first video on leaky gut, it helps explain why that occurs. So the different options for blood testing for food intolerances, in New York State, we are very limited about what we can do because there are policies prohibiting food intolerance testing, but there is one direct-to-consumer food intolerance test that can be done, which is through the company called Better Control of Health. You can order one of these test kits on Amazon, and that is a form of the IJUK food intolerance test. If you are in a state that approves IJUK testing, you could also have this testing done through Quest Laboratories. Basically, there's three types of antibodies that could create food intolerances or food allergies. The one that most allergists test for is IgE antibodies. Those are the allergies you've probably heard about before, which is peanut allergy and shrimp allergy. When people eat those foods, they get very dramatic, quick response to them. They might have throat swelling or tongue swelling and have to go to the emergency room or carry an EpiPen. Those intolerances, most people know that they have those. So it's important to see an allergist if you do have those reactions, but they don't test for IgG food allergies. Those are delayed antibodies. It can take hours to days before your body develops a reaction to the antibodies that are formed in your body. That's why it's confusing for patients to see a connection between the food and their condition. So the IJUK food intolerance test is one option. I have found that very helpful in patients in my practice. Naysayers would tell you that there's not a strong enough test-to-test validity, so that sometimes you might, it depends on how much of that food you've eaten recently. So if you've eaten a lot of eggs and you do the IJUK test, you might be more likely to test positive for it. And if you haven't eaten the eggs, you'll test negative for it. And that's also true for celiac testing. You have to be eating the equivalent of 2 slices of bread a day for 6 weeks before the test to really feel like you've had an accurate result. But so I will admit that there is some issues around that, but if you're eating a food regularly and you want to know if you're allergic to it, an IJUK food test is a pretty good test to do, and I found it to be very helpful in my patients. And the gold standard, I think, so far has been the Syrax food intolerance testing, which is similar to the IJUK testing, but their test-to-test variability is very low, and so that makes it a superior test. The problem with Syrax testing is that it is very expensive, and also that there are some states where it's still considered experimental and therefore is not authorized. There's another company called ElCap that offers food intolerance testing, and they do have a different methodology. They don't test for the IgG antibodies. They actually are just looking at your white blood cells in the petri dish that they add the partially digested food to, and they're watching what happens to that white blood cell. If the white blood cell swells mildly, they call it a mild reaction. If the white blood cell swells moderately, but also releases inflammatory cytokines, which is what creates inflammation in our body, they call it a moderate reaction. And lastly, if the white blood cell swells so much and releases so many cytokines that the blood cell dies prematurely, then they consider that a severe reaction. I used to test for that when I was able to do that in New York State, and I found that also to be helpful for my patients, but it wasn't always 100% accurate. But again, it really helped a lot of patients. So I also feel that that's a helpful test. And I think it's interesting, some people feel that the methodology isn't as specific, but a lot of people with food allergies have low white blood cell counts. And what I just described to you was that foods can cause those white blood cells to die prematurely. So it does make sense that that test has some validity, at least some validity to it. All right, other testing that some people are using to help diagnose leaky gut or food intolerances is complete digestive stool analysis. This would require a 3-day collection of stool, and It looks at the different food particles in your stool to rule in or rule out malabsorption of proteins or fats. And also it looks at inflammatory markers, so it kind of helps either rule in or rule out inflammatory bowel disease. It can look at your digestive enzymes and whether you have adequate levels of those. So there's a lot of information to be gained. One of my favorite parts of that test is the microbiology analysis. So the cause for breaking those leaky junctions can be an infectious cause, and so the microbiology analysis of the complete digestive stool analysis allows you to have a count of how many of the good bacteria you're actually growing in your stool. That's the lactobacilli group of bacteria, the bifidobacterium group, and also the good types of beneficial E. coli. And you will get a count, like was it no growth, or did you have 1+ growth, 2+ growth, 3+ growth, or 4+ growth, so that the doctor has a better idea about whether you need probiotics. Another part of the microbiology analysis is actually looking for the bad bacteria. So it looks for strep bacteria, many different strains of strep bacteria, Enterobacter, the hemolytic E. coli. So when you have a stool culture at your local lab, they're mainly just looking for the really bad players: Shigella, Salmonella, Campylobacter. And if you had some of these other bacteria that's overgrown, they don't consider that a pathogen, so they're not reporting it to your doctor. So for some of those harder cases that aren't getting better with standard medicine, this is a test that can go the next step to helping you find out why you're not getting better. The last thing they do check for is yeast and parasites. So a lot of people have yeast overgrowth as a pro-inflammatory source in our body, and this will help identify whether you have that or not. I don't find it to be 100% accurate. It's helpful if it's positive. It's not always helpful for me if it's negative. So I might go a step further and do like a blood test for yeast, but it's a good starting point for a lot of people. And the last test you can do for leaky gut is an intestinal permeability test in the urine. So this would require you to drink a packet of 2 types of sugars. One of the sugars is supposed to cross the blood-brain barrier of the GI tract, and then you urinate it out. The other, if the tight junctions are still intact, which you want them to be, the second sugar should be very low in your urine because your body should not be able to get it into the bloodstream. But if you have a leaky gut, it will be getting to the bloodstream and you will pick it up in the urine. You collect your urine for 6 hours after you drink that drink, and then you submit it to the company who will give you the result on a bar graph. So these are the different ways to test for leaky gut and food intolerances, and we'll get you started with your provider to help you figure out what the underlying cause of your disease is.